We went live with these cabanas today. We went live with the nurse call today, and we also started being able to do our own lab tests today. Now, we have right now only a capacity of around 80 patients a day, so those are going to be reserved for the sickest patients. Most likely, those are the patients that are going to be admitted into the hospital because they already have significant respiratory issues or something like that. COVID-19 is here in our community. It is being passed. I suspect there are more people, I don't want to scare anybody, but there's probably more people infected that know about it, and we're going to see the numbers rise in our community. Don't panic, number one. First of all, 80% of the people that are going to get COVID-19 are going to have relatively mild symptoms and are going to be at home like they would the flu. This is something to take serious, but not panic about.
We realize that there's a lot of concern in the community right now, but we are not testing everybody who doesn't even meet criteria. I know there's concern out there. Some people are calling into our call line saying, well, I have a sore throat. I'd really like to be tested for coronavirus. That does not meet the criteria. It's fever, cough, cold. And so we are saving the tests for the ones that really need it. If you have mild symptoms, we may not even test you anyway. We do what you normally would do if you have mild flu symptoms, but it's to stay home, right? Sort of do a self-quarantine is what we're asking people to do, even with coronavirus, right? So what would you normally do if you had flu? If you are concerned and you're one of these worried well, we absolutely ask that you do not come to the emergency department to get your questions answered. You're just going to expose yourself to other illnesses and put yourself at risk. So if you have questions, call the call line that we have, CDC website, or 211.
There may be a lot of young folks that go, it doesn't really matter, so I get the flu. Well, the problem is if they interact with somebody that is in a high-risk category, they could end up passing the disease, the virus onto them. And that we want to avoid. So we want everybody to take this seriously. Don't panic. Follow the guidelines that we're setting up, and we're going to get through this.